I have a question for somebody who have interviewed already. Did anyone in the room interview already?
Yes.
Um, so do you mind me asking, did you have any questions regarding research papers, like any publications that you had?
So my CV is sort of research focused already. For me, the question was, what has been your current research focus, and what are some of the highlights of your research that you want to point out or talk about? So the
Oh,
conversation sort of started from there. They didn't have any specific questions related to a certain paper, but they just wanted a general overview of what the research was.
okay, okay. Thank you.
I mean, what we could do is we could just throw out some questions and anybody could answer them, not necessarily doing a mock interview per se, but just sort of brainstorm some questions that we might have been having difficulty with.
You too. Yeah, that sounds fine.
Yeah.
Anyone has any questions?
Mm,
Okay. What are you guys answering for? What are some of your regrets? Or if you could go back and change something in your journey, what would you change?
I was in the States. I did my undergraduate in the States.
Hmm.
Um, I probably would say something along the lines of I sometimes think about what if I had applied to medical school in the States while I was there instead of applying abroad,
Yeah.
things would have been a lot different. But having said that, I would have missed out on meeting so many amazing people on the journey that I've already been on. So it's one of those things, right? Grass is always greener on the other side. So I do wonder what it would have been like, because I never actually applied to medical school in the United States.
Hmm.
No, so that's one of the regrets. I wouldn't say per se is a total regret, and I'm sort of I'm sort of like not answering it fully because I am adding the fact that you know what I mean. I've met a lot of people along the path that I've been on, and had I had gone to the States, then I would have not had the experience that I've had, right? But yeah, something that sometimes comes up. But it's a difficult question because you want. I mean, it's not good to have regrets in general, right? So,
Yeah.
um,
Yeah.
yeah. So, but everybody everybody who's human may have a little bit of regret here or there. But I guess you could say things can change. I guess you could also say that yes, you've had regrets, but with time you realize that it wasn't more of a regret, but it was more of like a learning opportunity, I guess, right? Um,
Hmm.
or something like that. I don't know. How about you guys? How would you answer that question? Because that's a really good question, actually. It's a very straightforward, simple question, but one of the more difficult ones to answer.
Yeah. So for me, I was thinking of like I don't have a solid answer for this, but I was thinking of saying something like, be more outgoing during my medical school, but then I don't want to come off as a person who's not fun loving because I did have a lot of fun.
Yeah.
So, but like I don't really have much regrets. The only thing I can think of, other thing I can think of is if I went to a different medical school than the one I went to, because I'm sorry, but we all secretly hate our medical schools. Um, so that's one thing I can think of, but I don't know how to phrase it in a way that, that you need to do it for an interview.
I think one thing that we all have in common is that obviously medical school is so much of our time and commitments are going towards that. So we could talk about how we see how our friends are able to, go on vacations, go on holidays, live
Hmm.
a certain life, start life sometimes a little earlier. Like I've seen a lot of my friends and family get married and have children, whereas for me, things have always been a little bit delayed because of my commitments towards medicine. But then I think if you say this, always end it with like end it on a positive note, right? Because then if you end it just there, it's like, okay, all right, so you didn't enjoy this path, okay, but no, that's not the case, because even though it's been a sacrifice, it's been worth it because of X, Y, and Z, right? So I mean, I guess that's not even answering the question, because then it's not a regret, right?
Yeah. Yeah,
difficult.
exactly. So not sure how to approach this one. That's why I was like, let's see what others think.
Yeah. I think for me is the medical school. Had I had stayed in the United States, things would have been a little different.
Yeah, so
It,
for you, then the counter question comes, why did you not?
yeah, so exactly. Then there's a whole story I've so basically what happened was I had a friend who I studied with in college, and this is somebody that I was basically tutoring the entire way, pretty much.
Hmm.
And I was planning to apply for medical school, but he actually told me about an opportunity to study in Poland. And at the time, he had applied and gotten into medical school. And I at that that time I just thought it would have been a great idea because I was born in the UK, and by doing medical school in Poland, it would also give me a chance to practice in the UK and do some training there, which I've always wanted to do, and I had family there at the time. So one thing led to another. I went to Poland for medical school, and then went to UK for my internship training. So that's how I ended up going that route, basically. So
Okay. So the
yeah.
next question after this is, then why are you coming back to the US?
Well, yeah. So basically, what happened was, while I had most of my family in the UK, while I was there, my family then moved to Florida, which is where I did my high schooling and undergraduate from. So my family was sort of back and forth between the UK and the US, but now my family are all sort of 100% now committed and based in the US, and they have been for some number of years. But one of my main reasons is I'm very family oriented, and I just can't imagine not living close by to my family. So that's probably one of the main reasons,
Okay.
among other reasons why I would want to practice in the States, of course.
Okay.
Yeah. Does that sound? I mean, that's actually the true story. But does that sound reasonable or?
If I was a PD, I'd think, what if his family moves again and he's like, okay, I want to go there now.
Fair enough. Yeah, I see your point.
Right. So
Yeah,
I would try to word it in a way that you have some personal interest rather than just familial interests that are attracting you to a certain place.
sure.
So for Poland, I really like how you mentioned, that it is the different healthcare system. So you were interested to see how the healthcare system there would work and what the difference it would be compared to the US where you were living at that time. So you
Yeah,
wanted to, you were open to that change at that point in life. But once you went through the system, you thought that your services or your education would be better in the US
sure.
in some way. Like you can
I,
sort of use
I
that.
actually, sorry to cut you off. Actually, to be more, so I actually haven't thought about this thoroughly, but to be honest, so I did my high schooling in the US and I did my
Mhm.
undergraduate degree in the US, and to be honest, US feels like home, and it's where I consider home. So right now, all my family stay there. I guess you could say my heart is attached. I have an attachment to the US, and
So just
just
use that.
yeah, I think so. I think so.
I
That
like
that
that better.
pretty much.
Yeah, so
Yeah,
you can just say it in this way that you did go to Poland and you had your like you did your medical school there, but the entire time you were there, you realized, now that you're away from US was home for you, and that is where
yeah,
you want to go back and
correct.
settle
Yeah,
down with your family over there.
yeah. No, I
So
appreciate that.
that sort of directs that your roots are in the US and you just took some time away to go to Poland.
Correct, correct. Yeah, no, that's exactly it. To be honest, so
Yeah.
even when I went to Poland, the intention, the plan was to go back to the States eventually. But yeah, no, no, for sure. I think letting them know that my roots are in the States, and that's
Hmm.
like where I've called home ever since I left, and I always has been home. And basically, yeah, yeah. No, that's great. Thanks.
No problem.
Yeah.
Other people have joined us. So does someone want to do like a mock interview? Anyone has an interview coming up?
Sure, I'll do it. I have one this week.
Yay, Erica. Internal medicine, right?
Yes, internal medicine.
Okay. Anyone who wants to take her interview, and then we're gonna do what we did. I think it was yesterday, right? When we were bombarding you with questions.
Mhm.
Someone who wants to start? I can start, but like I'm at work, so I might have to like mute myself in a few minutes. But let me just start. Okay. Hi, Ms. Jacobs. How are you doing today?
Doing good. How are you, Dr. Ariba?
I'm good. Okay. So how have you been? What do you think of the program so far? You've met some of our residents and had an introduction with us.
I think like I feel the program is amazing for me, and I would be a perfect fit here, given an opportunity. I like it
Okay.
so far. Yeah, and the faculty, it feels nice.
Okay. Um, so you said you would be a perfect fit for our program. What qualities do you think you have that make you an ideal candidate for our program?
Sure. So, firstly, thank you for this opportunity. It's an honor to be considered for your program. I think I would be a perfect fit because my work experience has given me some unique qualities. Today, when I sit here for the interview, I know what is the importance of being calm and respectful. I know how to advocate for the patients. I know when to ask for help. Um, yeah, so these are the qualities which my experience has taught me, and this is something which I would like to bring to the hospital. And as this program values such qualities in residents and values diversity, which my experience has taught me, um, I think I would be a perfect fit.
Okay. And let me ask you this. When you were looking for programs and deciding to apply for programs back in like September, August, or in the summer, what were some of the key features you were looking for in a program that you want to train at in the future?
Sure. So, firstly, I'm looking for the quality of training because these next 3 years are going to have a big impact on my career as a physician. So, for me, first priority is the quality of training, and I am looking for a place which emphasize on basic skills as much as on the technology and the evidence-based medicines. Second, I'm looking for a place where where I can develop good friendship and have a family because I will be staying away from home. I'm looking for a place where I can enjoy my work, and for me, enjoyment comes when people around me are happy and they treat me like a family. And third thing would be the locality. I have stayed in the East Coast for 4 months, and right now it feels like home because I've found a wonderful church family here, and I've met so many old friends and developed good relationship with them and made so many new friends also. So I would like to continue this, and also I'm looking for a place where there's easy transportation because I think for me independence comes from just being able to commute properly. And yes, so being here will make me more independent and will give me freedom. So yes, these are the qualities I'm looking for in a program.
Okay, okay. I'm glad that you have a set of qualities that you're looking for, and hopefully our program can provide you with that. Um, can you tell me a little bit how did you come to the decision that you want to pursue this?
Definitely. So yeah, I'm passionate about internal medicine for several reasons. Um, Throughout my medical education and my work experience, I've had the opportunity to get exposed to various medical specialties, but it was always internal medicine which stood out for me. There were various reasons. Firstly, due to the approach to a unique approach to a symptom, then emphasis on clinical skills, the provision of longitudinal care, and collaboration within the team. And my interest in internal medicine was further strengthened when I started working as a medical officer in rural India. I remember seeing patients independently with meningitis and sickle cell crisis, and I assess these patients and go back and consult every resource I had up to date, read articles, call my seniors from my medical school, and collect all that information and put it in the treatment plan. And seeing these patients getting treated and going home was nothing short of a miracle. So yeah, so that was the time I realized that knowledge does save life, and my knowledge can also save life. Also, I would like to add one more point. I'm a fixer when it comes to family and my friends, and for me, it's I would like to I try to bring solutions to just to have harmony in the family or to the situation. And I think this personality trait does align a lot with the internal medicine because as an internal medicine doctor, I will have the privilege to collaborate with the doctors of various specialities collaborate with care coordinators and social service workers to give holistic to for the holistic well-being of a patient. So I'd say these are the things which strengthen my interest in internal medicine.
Right. Okay. So you mentioned that you've worked in rural India. So how would you say that difference? How would you feel? Have you experienced the differences between urban and rural settings? And how would
Um,
you comment on that?
yeah. So when I was working in, from my personal experience, when I was working in India, firstly the medical advancement is not there in rural India, and compared to urban centers, we have super specialties which are able to guide us what to do and how to proceed. So second would be the patient education. In rural India, patients are not even aware of what is happening to them, and so people in rural India does try a lot of alternate medicines which are more harmful. In urban setting, this is still pertinent, but it's definitely lower than what we see in rural India, because 70% of the people who come to hospital are educated, and even if they don't know what they are going through, they'll at least Google and have some idea. And third thing, the cost is a big factor in rural India. Uh, in rural setups, the government hospitals and mission hospitals are available, so the costs of treatment is low, and even dialysis and CT scan are done at very low rate. But and when we go to urban centers, if it's a private hospital, these prices are very high. Even so, people must be insured to get these treatment. Otherwise, it's a lot on the pocket.
Mm-hmm, mm-hmm. Yeah, definitely. Rural setups do not have all the facilities available. Can you, since you've worked with such patients who had financial limitations and other limitations like that, can you tell me about a time where you had to advocate for a patient of yours?
Definitely. So this was during the time when I was working in Delhi as a junior doctor in nephrology department. My hospital is a private. I was working in a private hospital, but my hospital was doing some charity work. So every day they used to have few free dialysis slots for people below poverty line, and these slots used to be full always. And I remember a patient who used to come to us regularly. She was very compliant in treatment, and I became aware later that this patient is selling her jewelry and whatever she has just to be compliant on dialysis. And the patient is uninsured, and nobody in the family is earning. So I as a junior doctor felt very bad after listening to her story, and I did not have much. I couldn't do much, so I just heard a story and I spoke to my head of department, but who in turn is very kind. He went to the director and spoke to the director and administrative department. And my hospital, I'm very grateful that they opened a free slot just for that patient, so that she can continue and be compliant on dialysis without having to sell her jewelry and her resources. So yeah, that was the sure. So I remember when I was in medical school, I remember going to a leprosy house. These patients were, as leprosy is considered a contagious disease, these patients were abandoned from their family, and they were living in a old age home. Nobody used to visit them, and everyone was old, like 60 and 70-year-old. They just had one TV, and our hospital used to provide the necessary items like food and water. But otherwise, nobody else used to come visit them. So I and my other volunteer mates, we used to go there every month and have just just sit with them, talk to them, and perform musical skits, or just perform some dance in front of them, so that they feel nice and they feel included. So we didn't do much, as in medically we were not again doing much, but just being there, talking to the patient, and just using our privileges to help them feel included. That was something that really touched my heart, and I would like to mention this story. Yes.
Okay, okay. Yeah. All right. I think that's all the questions for me. Does anyone else want to ask her any questions?
Yeah, I just had a quick question. Erika, could you tell us about a difficult decision that you've had to make in the past year?
In the past year, sure. So, um, because I come from a family of non-doctors and I do not have any family in the US. For me, deciding whether I'm applying for USMLE or not and just putting my money in the USMLE journey was, I think, the hardest decision I made last year. Uh, and I'm glad I did it because I'm very happy where I am now, and my family is very supportive, and things have turned out well. And yes, I'm here sitting for the interview. It feels very surreal right now, but 1 year ago it felt impossible, so I'm glad I made that decision.
Could you tell me about a time that you had a conflict with a coworker and how you dealt with it?
Sure. So this is again the time when I was working as a junior doctor in nephrology. uh, I was working with 4 other junior doctors, and everyone was from different medical schools. My medical school and my training has always emphasized on the fact that documentation is very important. And because I was working in a non-teaching hospital, nobody was really was post call, and those days the progress notes were not written for the patients. So initially it was a little frustrating to me, and because I was the only one writing, and it was affecting the plan of management, continuous plan of management of the patient. So I just spoke to the my other colleagues, and I found out what was happening, and I made sure that they know what is the importance of documentation when it comes to uh, taking care of the patient, as well as for us to have a complete file. And I'm glad they listened, and eventually we all started writing notes. And even after I've left the hospital, this whole thing is continued now, and everyone writes progress notes daily. So even my head of department, who never used to check progress notes, now he's also impressed that people are writing without him have to. Yeah, with not because he told them, but people are writing, and they are very efficient in their work. And yes, so just because I was born in India, I didn't want to stay there. So I wanted to come out and explore. And why US specifically? Because it was my dream when I was in school to just come out to the US and explore this world out there. And it used to feel impossible when I was in school because of finances and so many factors. And when I entered medical school, I saw my medical school seniors coming out here doing so well professionally. And I started researching about it more, and it didn't feel that impossible. Um, so, yes, so I gave it a shot. And when I came here for my observership, I noticed the emphasis they give on evidence-based medicine and training, which is something which I'm looking for. And just being here, I spent 4 months doing my observership. I felt welcomed everywhere. I was respected even as an observer. And this is something which I'm looking for in a training. I'm looking for a place where I can put my word and make a decision, and have support from my colleagues. And also the location, just being here made me, I cannot explain, but it gave me a sense of freedom and independence. So yes, so I'm glad I made that decision. Yes.
What do you think your biggest challenge will be when working here in the US as a resident and even beyond?
Mm, my biggest challenge, I'd say every day is challenging. Every day we meet new people, talk to new people. Everyone has different expectations and different preferences. So every day is challenging. So there's not specific challenge which I can think of right now, but every day I know that I have to give my best because I'm here. Take like choose and handpicked from among 40, 50,000 people to be here in your program. So yes, so every day is going to be a challenge, but I know that I'm going to give my best. I will at least try to give my best. that didn't answer your question.
No, I think to be honest, I think it did. I mean, you said that it's going to, every day is going to be a challenge. And I think the most important thing is you said you're up for it. I mean, you could try and pick something specific. I mean, I don't know if it's something like, did you mention that you have family in the States
No.
or no?
Yeah,
So, I mean, yeah, you could say that, your family, that's going to be challenging initially, but then you could say how you could just go from there, right? That's totally understandable. But then don't make it seem like, oh, is she going to miss her family and want to go back, right? So if you do say that you miss your family and it's going to be challenging, which it definitely will be, but make sure you back it up with why it's important for you to do this anyways, and why, a positive spin on it, I would say.
okay.
I have a question. Can you tell me about a time you made a mistake and what you learned from it?
Definitely. So this was the time, I remember a time when I was in medical school. This was during my surgery, vascular surgery to be specific. And I was presenting, I was working up a patient with carotid body tumor. And I worked up the patient and I presented to a group of students, my vascular surgery head and other faculty. And I remember telling, while I was presenting the examination finding, instead of saying the mass has increased warmth, I said mass is warm. And for that time, to me, it looked normal. I mean, at that time, to me, I was still learning, and to me, it sounded normal and correct. But then the head of vascular surgery scolded me in front of everyone. He said, "This is not how you say it, because the whole body is warm. Only you should always say that compared to the rest of the body, your mass is warm. So always use the term increased temperature or increased warmth." So yes, that was the mistake, and I felt very embarrassed because I was scolded in front of everyone. But that mistake and that embarrassment did help me to be like present properly now. And wherever I go, like when I was working in rural India or urban India, urban healthcare center, and even when I came to do my observership, everywhere my faculty did did applauded me for the way I was presenting. So so I think that was the moment when I realized I made a mistake and I learned how to present that day.
Yeah, that was nice. Do you have like a memorable patient encounter you want to talk about?
Definitely. So when I was working, again, I was working as a junior doctor in nephrology department. I used to see my patients every third day. So after knowing these patients for so many months and then losing them did impact my life in some way. And I would like to mention one patient. This was a 19-year-old girl, and she was a known CKD, diagnosed a few years ago before I had joined that hospital. So she used to come regularly for our dialysis session, and she was a happy girl who was going through so much in her life, and she had stopped studying because of her ongoing disease. Also, she had so much financial issues because she was an uninsured patient, but her family was doing anything and everything possible just to make sure that she was getting her correct treatment. So but still, in spite of going through all these troubles, she was always a very happy person. And then last year, she had come to our hospital. She got admitted with fever of 25 days and weight loss. And in India, a patient with a chronic disease, especially CKD, our first differential was TB. And but we did not have any diagnosis for that because all her cultures, all her samples were coming out to be negative. So, and despite of that, we did start her on TB medications, and patient started improving. She also, and a few days after improvement, she threw a seizure, and we took her to ICU and got a CT done. She had tuberculosis in the brain. We started corticosteroids and we did treatment.
Of course. Do you want me to do it? Are you sure?
So I go on. So yes, this patient
Sorry about that. Sorry.
No problem. So this patient was in the ICU. We admitted her, gave her proper management for tuberculosis, brought her out. But this patient was having pancytopenia. We were thinking that probably because of CKD, she's having pancytopenia. And because it was day 19 of admission and she was going in and out of ICU multiple times, the hospital bill was very high. So the patient requested for discharge on day 19. She seemed clinically well. Our plan was to call her for regular follow-up. And I remember seeing her on Friday. telling her bye. And then Saturday she was all right. Sunday morning she came to our emergency department with rectal bleed because her pancytopenia had worsened very bad, and her platelet counts were less than 10,000. So she was bleeding from her rectum, and the time we took her to ICU, she couldn't. We could not revive her back. She arrested, and we could not revive her back, and we lost her. And I found out about this on Monday morning, and it it was because I remember her face, I remember her story, I remember her being so happy despite of going through all these things, and she lost her life. And yeah, so that is something like I want to take her memory wherever I go, so that I always work hard for that patient, because she was there when I was there. So that really gives me strength to work hard and motivates me when I'm lazy or when I don't feel like doing much. So yeah.
That's a good story. Where do you see yourself in 10 years?
Sure. So firstly, I would like to work in a hospital, because for me, it gives me joy when I'm in a hospital surrounded by patients, collaborating within a team, and just engaging in conversation with the patient and relatives. Secondly, I've been teaching since I was in high school, and it's a passion of mine. So I would like to continue this, and I would like to share my knowledge in any way possible, maybe at patient education or medical students, or even teaching my colleagues. Thirdly, because volunteering has been a big part of my life since I was in medical school. It's been more than 9 years now. So yes, wherever I go, I would like to continue, serving the community.
Okay,
And
good.
of my
You can continue.
I still have to get exposed to other specialties apart from nephrology to decide which fellowship choice I take. But yes, I want to continue growing and continue learning in whatever field I choose.
Okay, that's good. Just the last question. What do you like to do outside of medicine?
Sure. So I absolutely love sports. I've been playing basketball since school. Uh, and I am also very much passionate about keeping myself healthy. So I do some sort of workout, gym or exercise, Pilates, and I love jogging. Uh, and these days I'm in Dubai with my nephew, who's a toddler. So I'm enjoying teaching him action songs and teaching him songs and counting and teaching him how to talk. So this is something which I'm enjoying these days.
Okay. I mean, if anybody has more questions.
Yeah. What do you consider your weakness to be?
Sure. So when I was in school, I struggled with being overly self-conscious and hesitant when it came to talking to people, and I tended to keep to myself. And this whole thing, because of all this, my classmates didn't know me well. And when I was applying for medical admissions, since I come from a family of non-medical background, I knew I had to network extensively to gather information and for my medical field and the admissions. So this whole coming out of the zone and this whole experience did made me more extrovert and more comfortable in talking to people. And when I entered medical school, I worked on the skill every day. I participated in multiple activities where I could improve this quality, and it made me more confident and self-assured, which I lacked in the past. Uh, like today, when I look back, I know I've come a long way, and from being the quietest person in the family, and now when my family goes to church or any social gathering, I'm the one stepping out and talking to people, initiating conversation. While I may not claim that I'm 100% confident in talking to a larger audience, but yes, I have come a long way, and there's still a room to improvement. That was my answer for my weakness, socialization, in short.
Yeah, that sounds good.
I take a break for 2 minutes and just come back in 2 minutes.
We all talk about how we're all hardworking and so on, right? But then they might come back at us and say, okay, we have a lot of applicants who are also hardworking. What separates you from other applicants, right? It's a question I've not really thought about too much, but but I guess we could, if anybody wants to take a stab at that question.
Sorry, can you repeat the question? I missed
Oh,
it.
sorry. No, basically, you know how when we give our strengths, like for example, we are
Yeah.
hardworking, team player, and all these things. Sometimes
Yeah.
the program director might follow up with, they have a lot of applicants with similar traits and similar scores. What separates you from other applicants? Anybody wants to try and answer that question?
Yeah, I think that's one very important one. And I like in strengths, I always try to tell everyone not to focus on the typical strength that everyone mentions, that you're a team player, blah blah blah. I mean, do mention them,
Yeah.
but then have one that's unique. For me, I would personally say that one of my strengths that sort of sets me separate from the other applicants would be that I feel like I'm a very natural leader and I have strong leadership skills. And I sort of naturally take on leadership roles. And I think that might be important coming in the future chances of being a chief resident or having more involvement in some of the resident um, initiated wellness activities or some other activities like that. And I think that is something which is one of my strengths. Um, Other than that, I think my research background also is one of my strengths. Since I've spent more than 1 year just being focused on research, I do come with a strong knowledge and wealthy background of research into the program, which sort of sets me apart in the sense that I don't have to learn how to initiate a research project, and something which I have a lot of ideas for that I can get started on already. Yeah.
Oh, that's great. Could you tell us a little bit more about your leadership skills and examples of where you've had to use leadership?
So I have probably like multiple examples of my leadership skills, I would say, but one of the recent ones that I can talk about would be in my current role, I do lead a team of about 7 medical students through our research projects, and we are managing 5 different research projects right now. So this goes on from my medical students started working with me when they were in first year of medical school, and so I have sort of trained them from learning how to do chart reviews, how to use Epic, and then teaching them how to use SPSS, how to develop RedCap for surveys and data analysis. So I have sort of developed and trained them throughout the process of research, and now we're training them on how to write manuscripts. So I think that is one of the examples of my leadership skills where I'm very proud to say that my students are all well versed in all of these different aspects of research. Yeah.
That's really good. That's a really good answer. And for sure, I can totally see what you're saying. To mention a few things that are very unique to you, which are also strengths and which distinguish you from others. So definitely worth giving an extra think about for sure.
Yeah.
Thanks.
And
Yeah.
in this case, I think you can also always use things that are a bit different. So um, if your interview is not at a very IMG friendly program, you can always use the example that you come from a very diverse background. So you have dealt with patients with different socioeconomic status, for example, or have dealt with patients who had language barriers. So that really has developed your skill of dealing with the unusual situations and patients where you have many issues that you have to cross before you can actually give them treatment. So that can be a unique skill that you have because not everyone has that and not everyone has worked in that sort of a diverse environment. You can always use examples of if you have had a vast volunteer experience. So you can always use that as a strength that sort of sets you apart from other patients because other applicants because you have a vast volunteer experience and that has sort of taught you of how to advocate for your patients when they're not able to afford their medications or how to advocate for patient knowledge and how to have more, for example, patient outreach programs. So that can be a strength. So anything unique in your CV can be a strength that sets you apart from other applicants.
Yeah, no, definitely, absolutely. I'm just sort of thinking with my own CV. What do you think of this? it might be common enough to the point where it's not unique. But I was supposed to do 4 months in internal medicine at my hospital. This was a couple of years back, and when COVID, the second wave of COVID hit, I was asked by the head of internal medicine, if I would stay and continue for another 6 months. So essentially, I was working 10 months on the front lines with other junior doctors, and that experience, having gone through that, it's given me, X, Y, and Z characteristics, which I think might distinguish me from others, but I'm not sure really, because I'm sure a lot of people have also experienced working on the front lines.
No, I don't think a lot of people have experience working on the front lines, especially if you compare it to the newer graduates, people who
Oh,
graduated
fair
after
enough.
COVID,
Yeah,
right?
fair enough.
So it
Actually, that's a
does
good
it
point.
does set you
Great
apart,
point.
right? So you can
Yeah.
be like, I worked in internal medicine as a frontline worker during the high demanding time of COVID, where you know how dangerous it was for healthcare workers. So
Yeah,
try to
yeah,
organize the
yeah,
answer in this way. So
yeah,
I think that's a great strength. Yeah.
yeah.
So you can
Oh,
be like,
awesome. Yeah.
I've been through the toughest time that medicine has
Oh,
seen.
it was
So
hell. It
for
was
like
crazy.
nothing phases me out at this point. I'm up
Exactly,
for all
exactly,
challenges. Yeah.
exactly,
So
exactly. Cool. No, thanks.
mhm.
I have a point to add regarding COVID. So I would, for me, the answer was, the my experience has given me multiple qualities which I've put together, which I think this combination of characteristics are pretty unique to me, which is, I think, a good way to put it, where I'm like, okay, I have such and such qualities, which could be similar to other applicants, but like I have a combination of these, which is probably a little unique to me. And I think, yeah, COVID also, I always associated COVID with like a lot of resilience, because not everybody had that, um, had the phase of working in COVID, which I think was a very, very difficult time. So I think you can just relate it to resilience as well, because many people can tell that they're resilient, but they might not have very strong examples to show that they're resilient. So I think this is one thing I would have said for myself, and maybe if you would like it, yeah, you can use it as well.
Yeah, I definitely see your point. It's almost like tell me you're resilient without telling me you're resilient, right?
Yeah,
So
exactly.
Yeah.
So
yeah,
I think
definitely.
COVID is one place where you can really show them that, you've been there, you've worked for
Yeah.
such long hours in those PPs. Because I personally
Yeah.
had no change of PPs, and I had to work in the ER for like 16 hours, and then COVID
Oh,
ICUs
right,
for 16 hours. And
right,
sometimes it used to be like, if the next intern is sick or next intern is COVID positive, they wouldn't have
right,
as many. So I had to continue their shift as well. So it was
right.
literally like that, really shows that you're really resilient. So I think for
Yeah,
me, I would just add resilience and then relate it to COVID, because
right.
not many people can have very strong examples to show that they're resilient.
Right. And just
Okay.
to add to that, resilience is one thing, but also adaptability, right? Because I'm pretty sure most hospitals had to change a lot of um, departments of, wards and where
Right.
patients are being seen. You were now responsible for seeing an extra bay or an extra ward. So being
Correct.
adaptable, right? And changing needs at the
Yes.
hospital. So it goes on and on. I think COVID just gives so many examples of where we have to be a team player. Yeah, it just goes on, and you get the point, right?
Yeah.
Yeah, that's great. Yeah.
I sometimes feel like these two words of adaptability and resilience sort of get overused.
Mm,
Because your COVID experiences are very unique. So if we can use some more clinically related words, that can be, like a dynamic, demanding clinical environment, or
mm.
a rigorous environment that made you very adaptable. So just add stronger adjectives to the resilience, or
Yeah, I
stronger
think like
adjectives
we
to the
discussed
adaptability.
yesterday, I think working under pressure was something you
Yeah,
can put COVID as also, because we've had a
definitely.
high demand of patients. Everybody was testing positive, and then yeah, I mean high load of patients, not demand. Sorry. Yeah.
Okay.
Yeah.
Is Erica back? Should we give her the feedback and then move on with the next person?
Oh, yes, I'm back.
Okay. Your answers were good. I think you were pretty good. I noted down a few things. why were you choosing certain programs? Like, what qualities were you looking in a program? You mentioned something about transport.
Yeah, no need to mention
Yeah,
it.
like I wasn't sure what were you trying to say in that part. Is that related to your current interview? Does that matter with the current program? Um, so I would say just look into the program and see if that is something that relates to the program. If it doesn't, I would not use that part.
So I think like if it's like in New York or places where the public transport is like really really good, then you can say it. If not, I would agree to the point of not avoiding it.
Yeah.
Sure.
I like your other points where you said that, in the East Coast you have a nice church support now and you have friends now. Use that for sure, use that one. But with the transport, like I could understand the context. So maybe if it's related to the program, use it, otherwise don't. Um, and then the second one was why I am. I sort of got lost in that answer. Uh, I'm not sure. Does anyone have any feedback for that part?
I
Like
agree.
why?
I mean, I didn't get lost, but I felt it was quite long. I could
Yeah.
comprehend all the points that you told. I didn't get lost anywhere, but I think you can just cut it short into a shorter answer because I think it like went over 2 minutes. I think 2 minutes is itself a very long answer. And I think it went like maybe for 3 minutes. I understand that, you have a lot of reasons, but yeah, I think it's better to cut it short a little bit. Like maybe avoid the points which you find can be told by others also. And then maybe you can just mention your very unique reasons.
Okay.
Yes. Yeah. The case with the advocacy answer. I think the answer was a bit long. So if you can narrow that down that story a little bit, that would be great. Um, One thing like I would like you to sort of pay attention when I asked you, do you have any volunteer experiences? Um, you sort of took that answer as a descriptive one. I was just asking, do you have any? So you could have been like, yes, I have a lot of volunteer experiences. And then my next question was, can you talk about one of your unique volunteer experiences that you really enjoyed?
Yes, makes sense. Yes.
Okay. So sort of try to see how the interviewer has worded those questions because sometimes
I
they
think,
can be like, yeah.
yeah, no, just going on what you were just saying just now, I think um, just if you can, just sort of try and steer it towards a more conversational, um, to make it more conversational, right? Rather than just sort of question and then answer. I guess maybe I'm overthinking this, but I guess the tone of the way you're talking, right? Um, I don't know if that makes sense, but just it didn't sound more conversational. But I guess once you have an interviewer, um, it's obviously a lot different, right? Because like everyone said, I think the answers are quite long, and it sounds more like I don't know. I think you could make it shorter. If that makes sense.
Yeah.
Another answer which I felt like you could avoid a lot of details was your memorable experience. It was an excellent case scenario which you told. I really, really, really liked how you presented it, how you told about it. But I think it's just really, really long also, the tuberculoma one.
Okay.
So you can avoid like maybe like the small details, but yeah, you can give a gist of the case, but avoid like small details. Maybe you can avoid telling her cultures were negative, like this was negative, that was negative. You can probably say like the TB workup was negative, or I don't know, but try to like make it shorter because the case in itself is like really really good. I think this case, if you put it forward, it is very very nice, but yeah, I don't know how you can make it shorter, but if you could, then that would be a really great thing. Yeah.
Okay.
If you practice like saying it a few times in front of the mirror, you will realize how long you're talking and how many filler words you're using. Or you can just record yourself on any audio recorder and listen to yourself again. And we tend to use a lot of filler words or filler sentences which are not needed. Um, so you do need to use your time smartly when you're answering questions and not go over. what they want to listen or hear.
All right.
Okay. Otherwise, you're good. You have great stories. You have answers for everything. Yeah, that was good.
Yeah, I think I would rather have more to say and then try and cut it down rather than have short answers and struggle to find things to say, if that makes sense. So, I mean, so probably the work is less cut out for you in the in the sense that you've got a lot to say, but yeah, just maybe trim stuff out. I'd much rather be in that position than struggle to think of examples because you definitely have a lot to say. So yeah.
Okay.
I wanted to ask about one question. Like for myself, this is not a feedback, and if everybody's done with the feedback for Dr. Jacob, then I can go ahead and ask my question.
I think you can go ahead, Divya.
Okay, so basically, initially when I joined, I think you guys are talking about like a regret or something.
Yeah,
So
that's
I
right.
Yes, we were discussing that. Yeah.
Yeah, so I wanted to ask if it's okay to say that I don't have any regrets, and even if something I did was a mistake, I always consider that as a learning experience, and I would not regret that. So is it fine to say this, or does it sound like too much, or like this girl doesn't have any regrets, you know?
I think the way you framed it does make sense, right? Um, I mean, looking back, and if I do some honest reflection, there were times in my life where I had some real legit regrets. But with time, I think, and maturity, you learn that that you know you, I guess you regret having regrets, right? I mean, it's one of those things where
Mm-hmm.
you know, does that make sense? Do you know what I
Yeah,
mean?
yeah.
So you've had regrets in the past, but you mature out of it and you realize that they were in fact important bits of your life that you had to go through, and those things made you who you are today, right?
Right.
So I think it's more like self-reflection. So I totally see your point because I don't have any regrets, and a lot of people will be a little bit surprised by that, but that's the truth. But that's not
Yeah,
to
so
say that
even
I,
if something I did was a mistake, I always thought about it as like something to learn from. I never like regretted anything that I decided to do or any decision that I made. I've never
right.
regretted. Even if it was wrong, I've never like regretted it. I always thought that okay, next time I shouldn't be doing something like that. So I don't know if it's to be honest, I'm being really honest here, but I don't
Yeah,
know
no,
if
that's fine.
I should
And
be.
it comes across as very genuine what you just said, and I think a lot of people are like that too. But yeah, it'd be interesting to see what others think. But I think that came across as very genuine, and you don't have any regrets. You use them as learning opportunities, and you don't make the same mistake again, and
Yeah.
you grow from it, right?
Yeah, so it's like I really don't regret even the mistakes that I've made because I've always seen
Yeah,
them as something to learn from or not
yeah,
to
yeah.
repeat it
No,
again.
right. No, no. I totally think that's valid, right?
Yeah.
Yeah.
Does anybody else have any opinion about my answer?
No, I think you're fine. Like, if you the way you explain it, you generally don't have any regrets, so that's perfectly fine.
Okay, thank you.
Instead of making something up and not being genuine or not sounding honest, like this is better.
Okay, thank you.
Who wants to go next?
Hi.
Hi, Anna.
Hi. So I just wanted some feedback on one of my answers. So for a little background, is that okay with everybody?
Yeah, sure. Go ahead.
Okay. Okay, so for some background, I was basically born in Pakistan and raised in Canada, and then I went back to Pakistan to get my medical education. So naturally, I would be expect that I'd be asked why I went back to Pakistan, right? So I wanted to ask if mentioning any type of financial issues in that sense, in the sense that I didn't want to depend 100% on loans and be in that position and put my family in that position, because my family was going through a financial crisis at the time. So I started exploring my other options, and the most natural option was to continue in Pakistan, because my sister had just finished her MBBS there and she had a good experience. So I wanted to know if mentioning that is something I should do, or if I should, think of a different approach to it.
I mean, I'll tell you what I think. So I have a lot of friends who actually, like in medical, well, in the States, right? A lot of people do take out loans, and it's different from, the UK, and I think India might be the same in the sense that a lot of American graduates, and I'm pretty sure Canadian graduates, vast majority of them take out loans, right? So
Yeah.
if you do go that route, I do think it's a valid thing, and of course it just shows that you're conscious of these things, right? But
Yeah.
they might be like they might wonder like why because if you take out loans in the States, you start repaying them as soon as you get into residency, right? So it
Yeah.
might not make sense to a lot of program directors. If that's my total sort of like my understanding, right, of how things go in the States, and most people do take out loans from what I understand.
Yeah, that makes sense. So you think
So
that I shouldn't be using that rate?
yeah,
Like I should think
I
of
mean you
something.
could. You could. Look, I'll be honest with you. I went to Poland, and Poland was a fraction of the cost, right? I still had to take out
Yeah.
loans, but it was literally a fraction of what it cost. And that was one of the reasons why I went there. But I'm not going to mention that
Yeah.
because looking back, if I had applied to the States, right? It 5 years from now, it wouldn't have made much difference, right? So yeah.
Yeah, so if in your case you were asked why you were going back to Poland, when did your family relocate, or?
No, no, no. So I went to Poland for a different reason. So basically, for me, I graduated from Tampa from Florida actually, and I had a friend who went to Poland who had a sister who also graduated from the same medical school and had gone back to the US and done her residency. This is a long time ago. I'm an old graduate, right? So
Okay.
I had close friends and their relative and their sister who had gone down the path that I was hoping to also go down. So yeah, that was why I went. And also the sense of adventure, new country, these sorts of things, right? The excitement of practice of studying medicine abroad. All these things were so appealing to me. And also there were some really well-known professors actually who were teaching in Poland at the time. So we got really good training. We got really good medical school education over there.
Okay, that's good.
Yeah. So yeah.
Yeah,
So
so maybe I could just like along the same lines, because my sister also graduated from Pakistan, so she had already kind of set a path for me, right? So
right.
maybe that's
So
the
we're in the same
take I should,
boat actually. Yeah. I think
yeah.
we're similar sort of. Yeah. Yeah. So that's the way I'm doing it, and I think that's
All
the
right.
truth, I guess. Yeah. So
Okay. Thank you.
yeah.
And sorry to
Yeah.
everybody else who
No,
had to
but
listen, even if
what
it
if you
wasn't
also
relevant.
add what if you also add that you didn't want your parents wanted you to also gain like some culture back in Pakistan, and that's why you had to also go back. You can also include that as a reason.
Yeah, I actually was thinking of that as well, but after talking to a few people, it seemed like people thought that it didn't come off as genuine that you would move a completely different country. Like you're going from, if you think about it, you're going from a first world country to a third world country,
Right.
right?
It doesn't.
So
Yeah.
you want to seem genuine, and if it's just for cultural reasons, I can do a lot here to learn my culture.
Right.
So,
Okay.
yeah.
Makes sense.
I also have a point for Dr. Amna. You mentioned that your
Yeah.
family is also going through financial hardships. I think that
Yeah.
can answer that was the reason you didn't want to take more loan. So that's why you pursued residency in your medical school in Pakistan. Because you mentioned family, their hardships. It's not just you now. It comes to
Yeah.
your family
Yeah,
also.
but yeah, the reason I was asking is it makes sense, but just the loan system, like It's just that you don't have to pay it off right away, right? Like I would generally pay it off in residency. So there is that system that despite even if somebody can't afford it at all, um, like how the American grads take it, they're in a lot of debt when they graduate, but they are able to pay it off because they do get residency and stuff. So I wasn't sure, even though my family was going through a financial crisis, they wouldn't have to necessarily pay off my loans, or I in the future I might be in a position to pay them off. So, but yeah, that was my initial take on it. I thought it was good, but I did get a lot of feedback that maybe I shouldn't be using that. So I just wanted to bring it up here, and in case maybe somebody else has a similar scenario, or just to make sure.
Yeah, I would not use the loan part, and that
Okay, all right.
definitely does not. So,
Thank
yeah.
you. Thank you.
You guys, I'm gonna leave. You guys keep on practicing. See you tomorrow.
Can I just talk to you like for a quick minute, just
Sure. You
personally?
want? Yeah. All right. Which bring?
Which one is empty? 10?
All right.
In general.
Can you tell me about, sorry, I'm not asking you directly, but a question that we could brainstorm is sort of tell me about a patient or a patient encounter that's meant a lot to you and why, and or any kind of clinical encounter and yeah, how it influenced you. I mean, I guess this is the question that we're all sort of anticipating and preparing for.
Okay, so it's not like you're not telling about an interesting case. You're talking about something that meant a lot to you or like is dear to you.
Yeah, right. I guess you could link it to an interesting case, and even when you prepare for an interesting case question, you could also tag along that sort of aspect of why it meant so, why it was interesting, and probably it was also more than interesting because it impacted you in a certain way, right? So you could probably link them together. But you're right, this question is a bit more specific in terms of a patient that impacted you in a certain way. Maybe change the way you look at medicine, maybe change the way you approach a certain disease or what have you, right?
Right.
Does that make sense? Sorry.
Yeah, I think one encounter that I have, but I think it's in so basically what I have is in pediatrics. I don't know if I should mention it because I'm applying to IM. So I really don't know if
Yeah. I
yeah.
mean, I guess if it was something that happened during your rotations, during your medical school training, I think it's fair because look, I mean, I have stories from my obs and gyn placement, right? That are not
Right.
necessarily that show a more broader thing I'm trying to portray and get across, right?
Right.
But yeah, so I think it's okay. I mean, do you want to give it a
If
shot
it's
and
in
see
the
how it goes?
training period, you think it's fine to tell it?
I
Because
think
I've
so.
had
I
like
think so.
many internship experiences where it's like there was one exactly from an OBGYN patient also. So
Yeah.
this patient who was in labor for like a long, long time, and then she was just we were just there for her. We couldn't do anything much because she was a very non-cooperative patient. But I think like explaining her, telling about my mother going through her pregnancies, and like telling her about such stories where it's like I've seen so many patients go through this. I think you'll get over it. Just being able to motivate her, and then she finally, after she delivered and she got shifted to the floors, she was like in the morning when we went around on her, she's like, thank you so much. She introduced me to her entire family, and she's like, this is the doctor who stayed with me throughout the night. It was a rewarding experience. So I think I don't know if I can mention that because it's in another department, but it was a very dear experience to me because like many patients have not like gotten me introduced to their entire family because I was there for the patient throughout the night.
I personally think you can because it's nothing specific about OB/GYN. It could have happened in any other specialty, right? It could have been
Right.
a patient on the like on a cardiology ward, for example. It could have been anyone.
Right.
So yeah, I think it's fine, right? Yeah,
Okay.
yeah.
Anybody else who wants to add anything to this or comment on what I was talking about?
I think it's fine too. So far as you say it was during your rotations, I think it's fine.
Okay. Thank you.
Do you guys want to share about a time that you had to advocate for a patient?
I don't know if you heard to my answer yesterday, but I was talking about this this old man who came with very high blood sugars, but he was unable to talk anything for himself. His son was the one talking on behalf of the patient. So his son was very adamant on just receiving an insulin shot and taking the patient home. So I had to sit there and convince the son that this is something beyond just an insulin shot, and it could be a lot more. Because we had to get labs on the patient, and the son was very adamant on doing none of it and just giving an insulin shot. He was going on and on about this has happened before, and we have just given him an insulin shot. Before I came to the hospital, it was just 60. The sugars were just 60. And you're telling that now it's 700. I'm unable to believe it. So I had to recheck the sugars and tell the patient's son that, if your dad was the one talking for himself, then he would definitely probably consider treatment. And then, yeah, towards the end, the patient's son agreed to admit the patient and treat him as a, DKA/HHS, because we haven't gotten labs on the patient yet. But yeah, I think that is my example as to how I advocate for my patient. If that makes sense, or if anybody wants to comment on this as well.
I'm so sorry. I was can I just basically very briefly summarize what you said? Basically, so you had a father and son come in, and was it the
Right.
father that had high sugars?
Yes.
And the son, and you tried to explain that you had to sorry, this is the part where I missed. You had to initiate treatment for was it HHS? I think you mentioned yesterday. I remember this yesterday, kind of. I was in and out.
Yeah. So we
And
had to basically, I said, we had to admit the patient because we haven't gotten any labs, and in order to draw labs, the patient's son had to give consent, because it's we have to do some or the other tests to find out what is going on, because we just did a finger prick random glucose, which came out
right,
to be 750 or 800, if I'm not
yeah.
as far as I remember.
Yeah, I would say, why did you have to get consent from the son?
Because the patient was not
Oh,
talking
sorry.
anything.
Got it.
Right.
Sorry,
Yeah.
that's fine. That's fine. Yeah, that makes
So
sense. And
because the patient was unable to put forward his wishes, he was just sitting there in a corner, very silent. I
which makes
think
sense. Yeah,
yeah. So I had to advocate for the patient, because definitely somebody knowing that you could really go it could go south, the case,
yeah,
if it's not treated in the proper way. So somebody with that information would definitely want to get treated. And because the patient was unable to put forward his wishes or his wills, I had to
yeah,
convince the son to agree to the treatment. So I think that was one example where I really had to advocate for the patient. So I don't know
yeah.
if it makes sense, and if anybody
I think it
wants to
does,
comment.
but I think it does. But one thing I would add is, I think you finished the story a little bit too soon. I would go ahead and
Right.
finish your story completely and tell them the outcome and tell them how you felt really good about what you had done. And
Right.
does that make sense? Did you just
Yes,
go a
it
little bit
does.
further? Yeah,
Mm-hmm.
yeah,
Yeah, that does make sense.
yeah. Could I share with you a time that I was an advocate for a
Sure.
patient?
Yeah.
This is probably in my mind, I think it's a really good example because it led to a really good outcome
Mm-hmm.
for me. But anyways, let's just see how it sounds. So this was during my cardiology rotation.
Mm-hmm.
Sorry, do you mind if so when I say rotation, does that mean so basically it was during my internship year, right? But in our internship year, we still call them rotations or placements. Should I stay away from using rotation and placement? because that sounds like something I did in medical school, right?
You can probably use the words, but you can just
Intern
mention that, yeah, during my
during my
intern
internship.
year,
Yeah,
during my
yeah,
internship or intern year on cardiology rotations. So that
right.
sets the
More
scene
specific.
where
Yeah,
you
yeah,
were in the intern year and then you're rotating in cardiology. So I think,
correct.
yeah, it's fine to use the word, but you have to set the scene that this is
Right. No, that
during
makes
your
sense.
intern year. Yeah.
Yeah, no, perfect. Yeah, so during my internship year, during while I was in my cardiology placement, I recall a patient that we had just seen on the ward round who had a very low hemoglobin. I think it was around 60 something, the low 60s. This patient was being worked up for a GI bleed. Actually, there weren't any more GI beds, so the patient ended up on our ward, and we still rounded on him. I remember the consultant putting in an order for a blood transfusion, which I later that day requested. So yeah, everything was going fine. I remember going down, having my lunch, and then coming back upstairs. And as I opened the door to the ward, I saw this patient actually walking along the corridor. And I was kind of shocked because I remember this was a patient who had a very low hemoglobin. I looked around and I couldn't see any nurses, so I grabbed a chair from one of the nurses' stations. I put it right next to him and I told him to sit down. And I could clearly see that he was holding on to the side of the walls. And I think one of the nurses saw what was going on. And right away, I told the nurse that, this patient should really not be standing like this because of his hemoglobin was so low and he could be dizzy, he could fall. And I asked him where he was going, and he actually told me that he wanted to go see his family that were just waiting outside the ward. And I said, why can't they come see you? I'm sure that should be totally, that's more appropriate. And he told me that the nurse said, right now, we're not in visiting hours. So, it was a difficult situation. I couldn't find the head nurse, but I actually was able to get a hold of her and I explained the situation. And I helped the patient back to his bed. And I did tell him that, we'll figure this out. And I was so happy when the nurse told me that we could make an allowance because of the situation, right? So the family came in and was able to give lunch to the patient at the time. So yeah, I felt very good about this. Well, actually, the truth is, I didn't think much about it, but a week later, one of the nurses actually wrote a letter to my supervisor telling them that they were quite impressed with the way with how I handled that situation. So it was really rewarding. And yeah, do you know what? Do you think I should let them know about the recognition I got for it, or does that sound like I'm saying this story because of the recognition? Does that make sense?
Yes, I think I can see your question as to if you want to put out the recognition or not. You can probably you you could put it, you could skip it. Like I would say
Yeah.
it's like a 50
I feel
50 thing.
I feel uncomfortable talking about it, right? I feel really happy about the outcome for the
Yeah,
patient.
you can end your story right there. You can say
I
that,
think so.
it's,
Yeah.
and you can probably just say that the nurse was also feeling really happy that the patient could, that somebody addressed this problem, and then,
Right. That
probably
it
like it
was
was in the best interest of the patient,
right. Right.
because he's walking around with such a low hemoglobin. You can
Right.
obviously imagine the consequences of it. He can definitely be dizzy, he can fall, and if it's an old
Right.
patient, falls can be a very high
Right.
risk.
Exactly. And
you
yeah, he
know
was quite elderly. Do you think it's a good
yeah, you can
example
add
for
such
advocate?
things and then end your story with, it was, I think for me this was a very rewarding experience. And you can probably say something the patient told you you know
Oh, right. Well, he didn't say anything. He was quite old. He didn't really. He just wanted to see his family. He just was like,
Yeah,
yeah, I
so
just want
you
to go
can
see
say
them.
that, the
Yeah.
patient thanked me, or the patient's family really thanked me, and
Yeah.
something like that. But yeah, I mean, if you feel uncomfortable talking about the recognition that you got, because, like PD, I don't think the PDs see if you got recognition or not. They just want to know if you can or cannot advocate for your patient.
Yeah. Correct.
So
Yeah.
it
No,
doesn't really
thanks.
matter if you mention it
Yeah.
or not, but if you really feel
Yeah.
uncomfortable mentioning it, then it makes, I mean, it does no harm in skipping that part.
Yeah, no, I appreciate that. And I probably will, I definitely will skip it. But
Yeah, so
yeah,
you
no,
can probably replace it with something that the patient told you. You can say that the patient was really thankful and the family was very, very appreciative of me doing such a
yeah,
thing for them. Yeah,
that's perfect. That's
and
perfect.
that experience was rewarding.
Yeah, oh, 100%. I felt really good to be able to do that for the patient.
Yeah,
Yeah, yeah,
yeah.
yeah. No, great. Thank you so much.
hmm Any other questions that you feel like brainstorming or talking about?
Let's see.
So yesterday I just blanked out on advocating for myself, but I think I've really dug deep into my experiences and
Sorry.
I found one.
Yeah, I think
Sorry?
you did
Yeah,
good. I do remember. Oh, sorry.
you can go ahead.
Yeah, so
No, no. Yeah,
I found an answer for that. So basically, when I was in COVID and I was working in the ER, this was during night shifts. We had 16 hours of night calls and 8 hours of day. So when during my night calls in the ER, we were given just one PPE kit because we were supposed to wear the PPE kits in the ER because it was during the peak of the pandemic. So the nurses actually refused to give us a second PPE kit because we had to like grab something to eat or like use the washroom. So after coming back, they used to always say that wear the same PPE kit, which was actually not the way to do it. We had to be given a fresh PPE kit. So this, when I spoke about it to the nursing in charge, who was like the head for the PPEs and everything, she refused to give us. So I went ahead and I spoke to the student supervisor. So then he wrote a letter to all the nursing in charges saying interns have to be given the PPE kits that they need because 16 hours is a really long time to work. And I could see that the nurses were changing their PPE kits but were refusing to give us. So I think that was one time that I really advocated for myself. And then when the student supervisor gave out that letter, from then we all got a change of PPE kits when we were on 16-hour calls.
yeah, that's a lot. But I mean, I remember this from yesterday actually, and
Yeah, I
yeah,
really blanked out when I said
I
advocate
think
for
you nailed it.
myself.
Yeah, I
Yeah,
think you
so
nailed it though.
all right. So thank you.
Yeah,
So I just want to
yeah,
get the story and get a feedback.
sure, sure. Yeah, I
Just
remember this from
one thing I
yesterday.
would like, sorry.
Yeah, go ahead.
So I just wanted to mention one thing that maybe you should take out from there is the fact that you said that the nurses were giving themselves
Mm-hmm.
PPE kits and they weren't giving the doctors necessarily PPE kits
Mm-hmm.
because in residency, there's already kind of a imbalance between the nurses. There's a little bit of sometimes there can be conflicts and stuff. So that kind of sounds like you guys are two different entities instead of collaborating together. And
Okay,
you
got
want to
it.
give the idea that you're all working towards the same goal. So maybe not mention that. That's just the vibe I got from that
It
little
makes sense. Yeah,
yeah. So I
definitely.
just wanted to say that.
I'd
Other
avoid
than that,
skipping.
it's good. Yeah.
So I can just mention that the nursing in charge was responsible for the PPEs, right? And just skip the
Yeah.
part where they were using it and not giving it to us.
Yeah, maybe you can give the impression maybe they weren't aware that you guys are supposed to, but you advocated for the fact that you should be getting it, right? Like you
Right.
knew that it's a rule, maybe she didn't know, but just not give the idea that it is
They were
something
using it
intentional
and
that
okay,
yeah,
got
yeah.
it. It makes
All
sense,
right.
yeah.
Yeah.
A question for advocating for a patient. Does advocating for a 2-week-old baby count for advocating when you have a scenario when you asked about a scenario when you advocated for a patient? Do you think that counts?
I think it does because any patient is a patient irrespective
Okay.
of their age. If we eat a 1-week-old, 1-day-old baby
Right.
or a 70-year-old person, it
Yeah.
doesn't matter. As long as you are the one who's talking for the patient and doing
Mhm.
something in the best interest of the patient, I think it counts.
Okay, because the baby was had severe jaundice and the mom wanted to sign against medical advice, and I had to speak to the mom. I encouraged her, counseled her on
That's a
the
great
need.
example, I believe,
Yes.
because
Yeah.
if it's a severe jaundice, it can lead to
Mm-hmm.
brain damage and everything. Yeah.
Yeah, we
So
needed to
that's a
do like
great
an
example,
exchange blood
according to
transfusion. Yeah.
me.
Okay.
Yeah.
All right. Thank you.
Oh, I just remembered a really good example. You reminded me of one actually that I'll most likely use.
Mm.
Yeah, it's a patient who came in with her mom actually. Honestly, I don't remember the specifics of it, but whatever she had, I mean, I'll have to think about this. I think I wrote it down somewhere. But yeah, essentially, mom wanted her to go home, and she didn't feel like, that the daughter needs to be admitted, but the daughter did have to be admitted. Again, I forget the reason, but I remember advocating for the patient to the best of my ability. But in this case, unfortunately, um, the patient herself said that she wanted to go home. Yeah, I think it was influenced by the mom. But yeah, I remember it was like a night shift, wasn't it? It was like 10:30, and there were very few consultants around. I spoke to my registrar, but unfortunately, in this case, it was futile. But yeah, I do remember trying to advocate for this patient and trying to explain to her why she needed to be admitted.
Yeah.
And actually, just to the reason why, because again, I don't should say this, the same reason what Abna mentioned about the divide between nurses and doctors. I remember a nurse actually being so quick to give me what is it called, discharge against medical advice form to give to the patient, to have her sign it, so that the hospital and our department's not liable for anything that may happen to the patient. So I remember telling the nurse, no, we shouldn't do this, and we should explain to the patient first why she needs to be admitted, right? But yeah, I don't know if I'm going to include the nursing part.
I feel like you wouldn't want to come off as like, having not being able to work as a team with your nurse. So whatever that has to,
Yeah, that's
so
true.
just take that part out. Yeah.
Yeah.
That's a great point, actually. You never want to put out any that as a team, because nurses are also a part of the team. So I
Sure.
don't think we have to put out scenarios where it's like there's a disagreement in the team members, unless it's like a conflict. If they ask you about a conflict, then you can talk about it. But otherwise,
Sure.
I think it's better to always put out scenarios where you're working as a team.
Yeah,
Sure.
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 Yeah, that's a great point. Thank you, Dr. Oji. So I'm really sorry.
You can just call me Lovette. That's okay.
Okay, love it. Yeah, sure.
Yes.
You use teamwork to good effect.